Hey guys, decided to give you a quick update. So last week I had my pre-op appointment. It's official, my surgery will be in a week. I'm nervous, but I'm super excited as well. And my cat wants to say hi. Sorry. Would you go back, buddy? And so during the pre-op, they took some impressions. So for I don't know what it's called, one of those plates they put in to kind of align your jaw. I had a bunch of questions for my doctor because I have anxiety of like throwing up, and he said he takes a very like serious approach to prevent it, but sometimes it's inevitable. So about 75 to 80% of people throw up within the first 8 hours after anesthesia, and because he swallowed so much blood, he said he's going to try to cauterize as much as possible, but it just might be inevitable. So hopefully I will be too, I don't know, too under anesthesia to even remember or care much about it. And then he said they usually keep you overnight there. So a reason for that is the first night is very difficult. There's so much swelling, numbness, and everything else. So the next day before they release you, they want to make sure that you're able to drink on your own. Meaning, they'll give you some syringe and for you to swallow, since you'll be intubated pretty much. Your throat will be super sore, and so just with medications and anesthesia that affects it as well. And then he also wants to make sure that you're able to walk on your own as well, as you get super weak and stuff like that. The most swelling starts happening on like second, third, fourth day. Everyone's different, but the first week he said is very rough. I keep reading that a lot of people said they were on strict liquid diet for like 2 weeks, and then they were clear to eat like soft food or whatnot. He told me he doesn't want me to limit that. Pretty much anything I can kind of mush down and break it apart in tiny little pieces and try to eat. It's soft, of course, nothing that requires chewing. So that will be the goal. So we'll see. I'm excited that it's finally happening. I'm not looking forward to recovery, but I'm trying to prepare everything I can. I have this fantastic juicer that's able to juice and puree and everything you can think of. Gonna try to stay on top of the medication for pain and antibiotics. I got myself a little like upright pillow that because you can't sleep laying down. I got myself a bib because you end up drooling a lot, and just you can't feel your face at all or your lips or anything like that. So you'll probably need a mirror when you're feeding yourself, and a lot of that will be just falling on you. And then what else? Some ice packs for the face as well. Just and a little baby brush as well. As soon as you're able to like brush your teeth, you want to maintain it. I do wish I haven't looked up on YouTube the surgery. There's actual video that shows how they do it, and oh my god, I thought I was gonna faint just from watching it. But other than that, I'm super excited. Like I said, I know I said it 50 times. I'm nervous simply because it is a major surgery. But this is so good. I cannot wait to see what my face looks like. Another thing, so most of the time when they do an upper jaw as well, your nostrils end up going wider. So once they bring your upper palate forward, this right here just spreads. I asked him about it. He said he's going to do, it's called alar. I'm sorry if I mispronounce it. Alar cinch. So basically he will cinch right here and here. He said when I wake up, I'm gonna look like this, but he said those are dissolvable. They're just keep it there so the nose doesn't become wider, and then they will dissolve on their own within like a few months, or he said a couple weeks. I'm not sure, something like that. I'm getting that confused, but anyway, even though some people say that doesn't help them, so their nose does change, I'm not too concerned. I mean, if it changes, it is what it is. Also, he recommended that I get implants right here because my face is just so flat. Even moving this forward, it's not going to give that much fullness. So I'm going to trust him with this. He's done many surgeries and I've seen his results. So I told him, if you think it's the best way to go, let's do it. For that, I had to pay out of pocket. It was not covered by my insurance. Other than that, the rest of the insurance and the rest of the surgery was. And then what else I'm trying to think of? I also got myself some of the little condiment bottles because I keep reading that those are the best for eating food, then through syringe, and then drinking water and whatnot. So try to prepare as much as I can and be ready for it, but only time will show, and so I'll try to document as much as I can my recovery so you can follow along and see the progress. A lot of people have dysmorphia, body dysmorphia, because they don't recognize their face or their face looks different. I do remember I had this issue when I had my rhinoseptoplasty, so I had broken nose. And so right now even it looks much wider than it was, but I remember the first, oh my gosh, like few months I cried. I hated it. I missed my deviated septum. Like, this is so ridiculous, right? And so I'm gonna try to keep that in mind and just remind myself that the swelling, and it takes time. The final results are probably not visible until like a year. There is a concern, of course, that speaking difficult, smiling, the muscles need to regenerate and things like that. So we'll see what's going to happen. I'm praying about it every day, and I'm hoping that everything goes well, and I'm sure it will. I have faith in my surgeon and this process. So send your good vibes my way, and then yeah, I'll keep you updated, and I'll see you guys for the surgery day.